using this therapy that can help them to actually recover faster.
So today, thank you very much, Tricia Tee, for joining us today. Tricia is as I said earlier, she is the owner of justseifu.com. Tricia is a Seifu practitioner, and today she's going to talk all about what Seifu is and everything. So Tricia, let's just start with that being my first question, yeah? What is Seifu? Where did it come from? What does the word Seifu mean? Can you tell us a little bit more about Seifu?
Yeah, first of all, I'd like to thank you. Thanks, Shubra, for having me. Yeah, my name is Tricia. I am the founder of Just Seifu. So, what is Seifu? Okay, Seifu Therapy is actually founded in Japan. To be more exact, it actually came from Nagoya, Japan. So, it has been more than 25 years in Japan. And Seifu, if you go to the dictionary, you don't be able to find what exactly Seifu means in this kind of context. So what Seifu therapy is actually a therapy, a natural therapy. So if I will have to compare this to massage, it's actually totally different thing, because this Seifu therapy is the technique that Seifu therapy uses is usually do a lifting, meaning we literally do a lifting on the skin. For example,
right.
Just do a lifting on the skin. Yeah. So this therapy actually is founded by the person. The name is called Xu Jiang. His name is actually, he's actually a physiotherapist. So what he does to do is to help the sportsmen and sportswomen to perform better or recover from the injury as soon as possible. So the sportsmen and sportswomen that he actually serves are people who are national level. So for example, if they miss the competitions this round, they may actually need to wait for another 4 years. For example, SEA Games, Olympics. All this doesn't happen every year. So if in the event they miss all this, they will actually need to go, they need to prepare themselves for the next one. So it's kind of way. So the intention is to make sure that they recover as soon as possible. So he invented this, and then this is called Seifu therapy by not pressing but lifting. So because of his passion, because of he found that this actually can help them to perform even better after the injury. So he then actually innovate this to help on other conditions of the person. For example, people who have other ailments, they can help to do. So he ventured into helping people in wellness aspect, and also then help people in beauty aspects and also slimming aspects.
It covers well-being from both a physical healing, so restoration and healing, but it also does beauty, it does overall wellness. And Xu Jian sounds like a Chinese name, but it originated in Nagoya. Is he a Chinese gentleman?
I think he was born in China. He is actually Chinese, but he resides in Japan for many years. So I guess he is already a permanent resident in Japan. And what he could actually gotten is he gotten the recognition from the Japanese doctors, surgeons, and nurses. They do the research together, and also they are serving those people that actually recognize this therapy, and they do it in the hospitals.
Right. Okay. So Seifu therapy is already researched within the Japanese medical journals in terms of its effects on the recovery rate for some patients and different ailments. Can you tell me because we talked about physical restoration, beauty, wellness, in terms of physical issues, what can Seifu therapy help with? Like what type of physical problems or which type of patients have they been using Seifu on?
Okay, so in terms of wellness, actually it can cover many kind of ailments. So what kind of patients will be people who are having even chronic ailments, for example, people who have cancer, people who are going through chemotherapy. So this is a kind of a therapy can actually going together with chemotherapy, so that the person's body actually recover faster. So for example, when we go to when we need to go for chemotherapy. So if doctor not able to tell us how many times that we need to go through these sessions of chemotherapy, so it actually depends on recovery rate of your body. Once we have the chemotherapy, we we also need to recover from each session. So the therapy, the intention of this therapy to go together with chemotherapy is to ensure that the body recovers, and so that the person can go through another chemo. And finally, what will happen to a cancer patient, for example, when we go through with this chemotherapy is that will actually reduce the pain and also reduce the fatigue level and improve the appetite and improve the sleep. So people who go into chemotherapy, usually they have all these four kind of symptoms. And because of that, then they may actually, using this therapy, they can help them to actually recover faster. And the intention is ultimately to reduce the number of sessions for chemotherapy so that they can actually recover and become a cancer survivor.
I wanted to ask a little bit more about the Seifu itself. So you were talking about lifting of the skin. So where do they lift the skin, and how does it help in terms of recovery and healing? Like, what does the lifting of the skin do? Is it like pinching? Can you explain a little bit more about that?
Okay, so lifting of the skin is not pinching. The normal perceptions of pinching is something which is painful. So I do not like I pinch a person, then so the person becomes more painful at the skin. So we just literally lifting and then allowing the energy to flow through, so that the level between dermis and epidermis actually is higher, become more, there is a more vacuum for the flow of energy to go through. So the understanding is when the skin is actually compressed, so the recovery rate is actually lesser. So just for example, when we fell down, we fell down and then we feel pain, and the place that actually compressed. So why then we wanted to do is we want to expand the space, allowing more energy or more blood flow to go through. And with the lifting of the skin, what will happen to our blood vessel underneath the skin is the blood vessel actually expanded. So what happens when the blood vessel expanded is actually the flow of the blood flow actually will be faster. And also when we having this expansion in terms of blood vessel, it actually can induce relaxation. So by doing one action of lifting, we actually can achieve reduction of the pain. We can actually improve the blood circulation. It also can improve the relaxation. So if you ask me, I would say that this therapy is actually a positive approach compared to a negative approach. As in, positive as in we give the person, we induce the relaxation to the person's body so that the recovery is faster. So it's not the one that we actually let the person feel pain and actually recover. So this will actually, in the research, it's also shown that this can help brainwave therapy. So what brainwave therapy, usually we will go through a brainwave therapy, we actually can help people who are under depression. So for people who are under stress, right? So doing this is really very good because when we feel stress, usually we feel that there are compression. A lot of the things we didn't go through. So that is not an actual thing which is compressed, but we literally in our brain we feel that there's something, a lot of things we just feel that we're compressed. A lot of things are on our shoulder, in our brain, the kind of thing. So doing this therapy, it actually has activate the kind of functions that it can actually help to even improve the brainwave therapy, where the transmission to the brain is telling us that okay, we are relaxed, we can be relaxed because this therapy really transmits some information to our brain.
Right. Okay. So by lifting the skin, it's allowing for more space for oxygenation. It's it's allowing for more space of blood flow. It's allowing for more space for the hormones to sort of go through, and for that, the improved flow basically essentially is helping the healing process, or like making the healing process faster or more effective in a way.
Yes, correct.
Right. Okay. So then do you just hold it anywhere, or are there specific points? Does it follow is it similar like in Chinese medicine where it follows like meridian points? Like, is it just anywhere that you would lift? Like, where would you lift the skin?
Okay, so where do I lift on the skin is they do have you do have a map to actually lift in accordance to what is the requirement for the person. So let's say, for example, a person may be having headache, so we do have a specific point for the headache. For example, a person comes to me with insomnia issue, so I will actually have a special point for the person. So individuals are different. So of course, why do we do a full body Seifu therapy? Is actually to generate the energy to flow through. Yeah. So then the flow is when the flow is fluent, and we target on the point that the person required. So then the fluent and the fluid kind of movement, and also this kind of flow of energy, and also oxygenization of the cells actually faster and better.
You've obviously done Seifu Therapy now for a number of years. Can you share any sort of success stories that you have that, you know, when you've given Seifu Therapy to some people that they've had quite, you know, successful healing stories, for example? I remember you shared one about yourself. That's how you sort of got into it. Can you share that?
Yeah, okay. So why I got into it? Yes, I do have knee problems. More, last time I used to go to I go to any kind of sports like sports day, or any kind of sport like basketball, volleyball. I think that is because of my build is high. People will actually scout me to play. So I
It's the
don't do
same as me.
preparation.
Everyone used to put me in the basketball team because I was tall.
Yeah. So then okay. So I will just go there and play for the fun of it, and then yeah. So but when I was younger, actually I do not know that I need to do a lot of warm up, and I don't go to a proper training. But what I was concerned was just to participate in the training, in the game itself. So I injured my knee, and so then what happened to me is my knee was actually swelling every 5 years. When I went to my GP told me, yes, last 5 years you came here for the same issues. And what I was being prescribed is steroid and also painkillers and to anti-swelling kind of pills. So that made me very upset. And okay, so what am I going to go through is next time when I'm going older? So I'm going to bear with this. And every 5 years I need to go through this kind of things. So I wouldn't want myself to go through this. And that is not so I actually venture into this, and then I learned, and okay, yeah, after I do this for myself, and I do not actually having this issue, and yeah, I do not need to go through the medication like every 5 years having this kind of issue. So that helps me a lot. Yeah, so that is the very first point. Yeah, why I actually go into this therapy. Yeah, but of course, why then I went to become a full-time psychotherapy. So I do have another reason why I become a full-time. So one of the reasons is when I go to Japan, the Seifu convention, so there are many people over there. So all the conventions that invited people, medical practitioners and doctors, surgeons, and nurses that actually come and chat about what did they help, who did they help. So one of the testimony I saw is the man, the person that they healed that man actually had been bed sore. I knew about how painful it is as a bed sore patient because I saw my own dad actually pass away because of bed sore condition. So I know about that is because the cell actually dead. Therefore, that person actually not able to bring the pain and the kind of thing. So as a layman, I feel that, yeah, so if that actually helps this group of people, then how good that if I actually could help my own father to help to do this therapy. Yeah, but my father actually is no longer around. So, and then I think of how can I help other people? So I went to this because I saw that if we as a person feel so upset because we didn't able to do we didn't do our best to help our loved ones. So I will actually live in regret because I'm not able to do my best. So when I know that this can help, and as a layman, she can actually help in the cell recovery. And this is something very great that everyone should know. So that's why to do this is actually one way of contribution to my own parents. Yeah, so that because of them, I see that the pain in seeing other people, seeing our loved ones in pain. So I like other people to know that it is a way to help ourselves. You know that you have done your best, because even the simple thing as doing Seifu Therapy can help them to actually relieve the kind of emotion pain. Yeah. So that is why I actually went into Seifu Therapy as a
Right.
full-time practitioner.
Right. I mean, thank you for sharing that really heartwarming story. That must have been pretty tough going through watching your father go through that. And then you come across another gentleman who was basically healed through Seifu therapy from the same sort of ailments. And that led you to become an actual therapist full time. So that's amazing that at least, that it's so commendable that you're using the rest of your life to go and help other people using this therapy form. So if I know before COVID-19 obviously hit, you were visiting people or your clients in person to do the Seifu therapy. But now, since we're currently in lockdown, is there a way for clients to still be able to get Seifu therapy? Like, can they do it themselves? Well, are you teaching people like what's happening during the situation with COVID and Seifu therapy?
Yeah, indeed, I was feeling very depressed on the first day of lockdown, meaning the first day of circuit breaker. I felt that I'm not able to serve my cancer patient client, where she needed my service a lot. And even my own my clients that I usually serve are people also dizziness, people who are having a chronic dizziness. They go through many different kind of tests and couldn't find out what happened. But they came to me and then they actually got a relief, and they're looking forward to seeing me. And they can't get a service. So I went into this. I came up with an idea, and I did this teletherapy, meaning on the phone, on the Zoom call, I actually teach the husband to do this therapy for my client, and she could actually relieve her dizziness.
Oh,
So
wow.
that is something that which is so amazing that I really thankful that I could actually help her to relieve this dizziness. Yeah, so something that I couldn't imagine how this could actually happen. I mean, it must be coming from uh, her husband actually wanted to help her a lot, and I felt that I would like to help her as much as possible. And due to this kind of condition, I can't help her. Therefore, I actually went through this idea to teach the husband. Yeah. So another thing that people can actually get this therapy services by attending the workshop that I teach online. So the person can actually learn this online, and then they can do it at their own at home whenever they want. Yeah. So this would be something very simple to acquire and very effective on the result.
Yeah, and you were talking about the simple and the effectiveness of it. I mean, I never got to ask, but can you do Seifu therapy on anyone? Like, for example, obviously some therapy forms say, oh, you can't work on pregnant women, or you have to wait till the first trimester is finished, or you can't do it on babies or children. Is there any sort of like age restriction or limitation for learning this therapy for people if they want to learn it for themselves and attend your workshops? Is there any limitation?
Oh, there's no limitation. So the advantage about this therapy is it can serve any people with any kind of condition. So, for example, my youngest client is actually 3 week old, and my oldest client is actually 90 plus. Yeah,
Three
and I
weeks, like a baby.
and it's an infant, so she not even 1 month, because this baby was having constipation issue. So I actually help her to actually release the constipation issue. And the oldest client I did have is actually a stroke patient. She is still a bedridden, but after doing therapy for her, she could actually gain some movement. Yeah, and people who are healthy. Yeah, so people who are healthy, like for example, when I do this therapy, I was a visiting practitioner for 3 luxury resorts by the name of Six Senses, One, and also Four Seasons. So people can go there for a holiday. Yeah, so I actually do therapy for them. So these are the people who are healthy. So they can do this therapy, for example, to de-stress, to actually having relaxation. So this can be done for them. in short, is for any people, any age, any condition, all are actually this can actually serve this group of people. This means everyone.
That's amazing. It's such a versatile healing form, because I mean, I'm one of your clients also, right? So I can vouch that when I was having sleep issues, that I also remember doing your sessions, and my God, like I completely zonked out those nights. And even recently when I did one of your online workshops, I remember, and you taught us, and I'm hoping you're going to teach a few of those kind of things today, but when you taught us like just to do the basic lifting on our hand, I got so relaxed suddenly that I was like, oh, I'm gonna start closing my eyes. I better switch off my video and just listen, because I just got instant relaxation, because clearly my body is starved for sleep at the moment, right? Because we're working from home, got the child, I've also got work in the nights and this and that, so it's all sort of all happening at once. And then as soon as I did that, clearly my body just went yeah, it's great that anyone could do it, and then you can almost get sometimes immediate effects of what your body needs at the very moment that you're doing it. So that's amazing. Could you show us a few things for our listeners, like what they could do? Like, what's the basics of Seifu, and maybe like 2 or 3 sort of things that they do at home on their own?
Okay, Seifu Therapy actually gives whatever your body needs. So when your body needs, your body call you for sleep. So definitely it will give whatever you need. So the very first thing is come from whether you believe that this is the therapy that it will actually help your body. So the therapy will work on you when you believe in it. So that is for sure. Yeah. So okay, so the basic thing what we do in this therapy is we just list what you have gone through, and what everyone can also do is actually it's just using 2 fingers. So we are using these 2 fingers as to help on our body. So what we do, the basic thing that we do is actually we just lift up, and then we just lift the rest of the 3 fingers. Yes. So
Okay.
we just bring these 2 as the activations of the Seifu Therapy. So what I usually teach in my workshop is I will just only do on the other hand. So
Okay.
because of this therapy, we can actually do in any organs, any places. So the most convenient way that we do is on our palm, because palm is the most accessible organ that we can see this. We use this so often, and we are not even doing therapy on this palm. Or one of the things that you can get rid of doing is by doing this, by doing therapy on your hand, you actually getting away the time to swipe on the phone for social media news or anything. So instead of getting the news which is don't know real or not real, you spend the time to do this for yourself to improve your health. So you can just do the lifting, like doing this, and then we just do a lifting, and then we put back. Yeah. So we just go to the in between the fingers, do a lifting, and then you put back. And you do a lifting, and then you put back, and do a lifting, and then put back, do a lifting, and put back. So any simple lift in the person's body, it kind of. So just like for example, why are we doing this on the skin? Skin is the biggest organ in the body, on our body. So we're treating on the skin, and we're also treating where does the skin actually go through. Just imagine there is a piece of cloth. You're doing it on the piece of cloth. When you do a lifting, so there are a lot of trigger points that it actually can link up to, because you do a lifting, so other places also being actually benefited. So that's why how powerful is lifting is just because of it can trigger, and it can be done for many many people and many places of our body, because the largest organ of our body.
Right. So then if you're lifting from one point, you could be actually affecting another part of your body. And I remember you mentioning that the hand, I think most people would, have come across this, but the hand and the feet are basically acupressure points that link to different parts of your body, including different organs. So for everyone that's listening out there, just listen. I mean, we're practically on our phones and on our computers all day now, and our hands are constantly just working at it. So clearly just doing some lifting and in between the fingers is going to start giving some extra oxygenation, and then, you know, it's going to give you some extra flow of energy, and then that's going to just influence all the body parts that are connected to your palms in that sense. Is that what I'm understanding correctly?
Yes, but in order to do it correctly, so it's better to go through the guidance to do it correctly. But of course, whatever if is clear and good enough, so in order to better and do it correctly, so it's better that person can actually come to the workshop and we can actually teach them the correct way of doing this.
Absolutely, that's true. So you can go away with a little bit today, but it would be much better if you attended the workshop so that you actually understand the subtle differences of lifting and not pinching, and, you know, how to actually, you know, hold the skin in the correct angle, for example, and things like that. So all of that information is going to be covered in one of Tricia's upcoming workshops. Tricia, are you doing like a generic workshop that any adult can join, or is there a specific workshop that you're doing for just women or just mothers to do with their babies? Like, what's upcoming for you?
Wow, the workshop that I'm doing on the weekly basis is actually the introductory to Seifu Therapy. So this is an introductory, meaning I will teach people on what is the basic way of doing Seifu Therapy correctly, because the person will learn this and then do on the vital, one of the essential organ we have, or one of the essential things we have is using our hands. So by doing on the hands, it actually can help on the vital organ. And the way that I do is, I incorporate music, I incorporate breathing, which is helping the person to relax. And this is a very fun kind of online workshop. And also, people can learn to do the therapy to help on releasing your stress. So that is the introductory. So the next one that I do have is actually level 1, which is the person can acquire the skill to do this therapy for themselves, which is from the head to the feet. So we can help ourselves with, if you're having headache issue, if you're having some vision issue, which is like you feel tired because of we are doing so many Zoom, so many things on the phones, and also watching TV. So you definitely have the tiredness every time. I mean, during this, I think you will have a lot of tiredness, especially during these seasons for your eyes, because okay. So on top of that is also doing the therapy for the ear, and also people who are actually having digestive issues. So doing this therapy can help to, learning about how to improve the digestive system, and also the joint issues. The person may be having joint issue, that this can actually learn about how to improve the reduce the pain that the person is going through. And until the feet, you can just do this therapy for the feet. Again, it's my kind of rejuvenations that you can do. Yeah, so this head to feet kind of therapy. You can actually learn to do this.
Introductory, and then introductory is more about just learning about what Seifu is and the very basics, and then you learn a bit to do it on your hands, and then you say level 1 is sort of like head to toe, so joint issues, vision, headaches, digestive issues are all sort of like covered in the Seifu therapy that they can do from head to toe in level 1. And what else do you have after that?
Okay, the next one I do have is level 2. Level 2 is more of the woman. So woman who wants to improve the woman's wellness, for example, improve the our breast health, our womb's health. So, and these are the very good therapy to do it yourself. And also another thing is about helping the beauty, Seifu for beauty. Yeah, improving our face in terms of reductions of wrinkles, in terms of reductions of the pigmentations, lifting of the face, and the reduction of the pores. So these are the things that they can do it themselves. And the last one is reduction of fat burning, meaning people who want to reduce the fat, and then they feel that it's not effective just doing exercise and eating, and then they want it to be more. They want to have more, so they actually can do this therapy to help themselves to have more burning kind of effect.
Right. Okay. So the women's one is specifically like breast health, womb health, face, anti-aging, sort of like beauty for your face, as well as like slimming and, cutting of the fat. Is this, would you recommend the women's one for anyone who has had babies already or hasn't had babies, or it doesn't really matter? You can have had babies or not have babies.
It doesn't matter because it's not invasive, and then even people who are pregnant, this can actually help the womb's health, and it will definitely benefit to the baby.
So pregnant stage 1, first trimester, second trimester, third trimester, doesn't matter. You can still do this therapy as well. Right. And if you were do you have to do the levels sequentially? So do you have to do introduction, then level 1, then level 2? Is that recommended? Okay.
Yes, because it's more specific. So I want people to learn through the proper way. So you don't risk yourself to do this wrongly. So that it doesn't have any other side effect. I mean, it definitely don't have a side effect, but we just want it to be more effective. If not, you're wasting the time.
Yeah, no, it's true. Like if you're going to go from step 1 to 10, you have to go 2, 3, 4 rather than jumping all the way to 10. So absolutely. And then do you have any other future courses that are coming about that you're still in the planning for?
Yeah, so the future courses will be, I will actually launch this in the future, which is Seifu Therapy for babies. Yeah. So the baby, as in the mom, can actually learn to do this therapy for their baby. Yeah. So for example, one of the person that I help, one of the baby I help is the infant, which is having constipation issue. So when the baby cannot poo, the most stressful people is actually the parents. So if you can do this therapy to help, so it doesn't need to go through some medication. So baby, infant, the best thing is, I think people who like to go to a natural way, so these are the best way that the person can help.
So like babies, you see like very, very young infants, or you're also talking like toddlers who are like 1, 2, 3, 4, 5, doesn't really matter, mothers to do on their children?
Yeah, it doesn't matter. So like 3 weeks or just newborn, and also toddler. I do have my youngest therapist, I would say. She is actually my grandniece. I did this to my another grandniece. She saw me doing this. And what happened is she learned this and she actually offered her Seifu service to the parents.
Your grandniece is
and,
treating her parents?
this is my nephew and my niece-in-law. So my grandniece would tell, Papa, Mommy, can I do Seifu therapy for you? So she learns, she copy what I do, she go and do it for the parents. So that is some heartwarming story. So there are so many heartwarming stories that I got through from this. When I got through and become a Seifu therapist, and I see that, and it's so heartwarming that bonding is built for this during this kind of moment. So that is something that I think is very good to share the knowledge so that something can be built.
I wanted to just ask one last question. And, with Seifu Therapy, because this whole podcast is called Shift with Shubra, and it's basically about sharing information so that people can start shifting their perspectives. And what is the shift of perspectives that you would like people to have with Seifu Therapy?
Okay, the shift I would like to create is suffering is actually a choice. So we do not need to suffer to get healed. We can still relax and get healed. So because the emphasis of the therapy is get relaxed and heal. By we having a relaxation, relaxed body, the acceptance to any therapy, to any healing is actually faster. And we can relax our mind, our body, and get the healing at the same time. So this is what the emphasis of this therapy. Yeah, and another shift is actually about living without regret. What I have gone through, I've seen my parents pass on, and I actually feel pain. But by learning and by knowing that there's such simple therapy that you can do, or you can actually get another person to do this therapy, but you can actually feel that you have done your best. And living with regret is a painful kind of situation. So by having this as a final moment that the person goes through, this actually helps the person who's staying behind to feel that they have done the best and is living without regret. Yeah, so that is shift that I want everyone to have by knowing, by doing therapy, by doing this therapy for themselves, and also doing this therapy for their loved ones.
That's amazing. I mean, and for everyone that's listening and watching, basically, Tricia is the only Seifu therapist in Singapore. So if you want to learn Seifu otherwise, you have to go to Nagoya, which is pretty far and kind of impossible at the moment. So please definitely look into her courses. They're really, really good. Even just the introduction was amazing. And she's running that weekly, as she said, and then she's going to be running level 1 and 2, and then future courses for moms to do Seifu therapy on their babies. And again, this is like non-invasive. It is very, very safe. It's very gentle. It is literally just lifting of the skin, and already so many benefits just come from that. So I just want to take an opportunity to thank Tricia for her time and for sharing about Seifu therapy. And we will be sharing all her details in the show notes below. So please get in touch with Tricia. Tricia, thank you so much again for doing this. I really, really appreciate it. And I hope more people do Seifu, because I think it's amazing what you're doing. And I think it's like one of the easiest things that we can teach all generations to do for their future health. So thank you so much, and keep doing the good work.
Thank you so much, Subra. Thank you for your invitations. I appreciate it very much. Thank you for helping to spread Seifu therapy.